Hello, I'm Kristen Fanning. I'm a Master of Biomedical Science student at the University of New England, and I'm going to be presenting the von Hippel-Lindau syndrome on July 25th, 2026. Von Hippel-Lindau, or VHL, is an autosomal dominant and inherited neoplasia disease that occurs in 1 out of 36,000 births following a germline mutation of the VHL gene. The symptoms are hemangioblastomas of the brain, spinal cord, and retina, renal cell carcinoma, pheochromocytomas, pancreatic neuroendocrine tumors, and endolymphatic sac tumors. So there's simply a lot of cysts and multiple kinds of cancers associated with this disease. The two types of testing for VHL are targeted testing and a multi-gene panel. Targeted testing is simply a single gene test for a particular variant, and it's ideal if you have a known family history for further cascade testing or if you're experiencing any clinical symptoms associated with the disease of interest. The multi-gene panel screens multiple genes that will point to a specific condition or category of conditions all at once. So it could simply confirm that you inherited a mutation or some mutations for hereditary cancer syndromes. And it's ideal for complex personal or family history. So if there's overlapping phenotypes of, for instance, cancer or heart disease, or you can do the panel following a negative targeted test. On to the pros and cons. For targeted testing, it's only focused on the VHL gene, and it's good for those with clear symptoms or family history, but it's not picking up any overlap from other diseases. So, if you were tested positive for the VHL mutation, you may not know if you have a gene for a different cancer or a gene for age-related macular degeneration. The multi-gene panel, as stated, screens multiple genes, and it's good for overlaps and multi-syndromes, and you may be able to find unexpected genetic risks like I'm getting tested for this cancer gene, but I didn't know I also have this gene that might heighten my risk for diabetes. However, it may detect variants of uncertain significance, which may frighten the patient or lead to some confusion on whether they should be concerned about the variant or not. So, for clinical symptoms, I would recommend a targeted testing. With the clinical symptoms present, testing for that gene can lead to a process of elimination. Hence, if the test comes out negative for VHL, they can then run a multi-gene panel to check for other diseases. But if the targeted test came out positive, the provider can set up a treatment plan for the patient, and therefore saving time and ensuring that the patient gets screened for anything immediately. As for the ethics, the autonomy for targeted testing, it's a simple test for one condition, where a multi-gene panel is a complex test that may uncover other genetic risks or conditions. The beneficence for targeted testing, it's good to set up a treatment plan if a patient has family history or symptoms once the gene is confirmed. But for the multi-gene panel, due to uncovering other potential risks, or other conditions. It may broaden the spectrum of treatments, and it may also play a role in what kind of drugs you're taking. For non-maleficence, targeted testing, due to its simplicity, gets rid of uncertainty. So, do you have the VHL mutation or not? It'll give you the answer. But for multi-gene panels, it may detect variants of uncertain significance, as stated, which may heighten the patient's anxiety, wondering whether they should be concerned about it or if they should let it go. As for justice, targeted testing is cost effective and efficient, but for multi-gene panels, you have more information, but it may be more expensive regarding the types of surveillance and treatments. So that is my applied genomics presentation of the von Hippel-Lindau syndrome. Thank you.